I'd like to briefly tell you about a review article that explains and details how implanted epilepsy devices can best be managed after they're implanted during clinical care for surgery and imaging. Hi, I'm Brian Lundstrom, an assistant professor of neurology and biophysics at Mayo Clinic in Rochester, Minnesota. This article is titled "The Safety and Management of Implanted Epilepsy Devices for Imaging and Surgery," and will appear in the November 2022 issue of Mayo Clinic Proceedings. Patients with epilepsy have many options for treatments these days that did not exist in the past. One of those options is to have implanted devices placed to treat their epilepsy. These implanted devices include vagus nerve stimulation, responsive neural stimulation, and deep brain stimulation. This form of bioelectronic medicine is a little bit less familiar to many people than other forms of treatment like medication or surgery. Because it's less familiar, it can create confusion around how these devices are best managed during surgery and during imaging after these devices are implanted. For that reason, we have, in this review, collected and summarized manufacturer labeling for these devices and recommended practices for how these devices are handled during subsequent imaging and surgeries. For example, here at Mayo Clinic, we have a very detailed workflow for evaluating patients and implanted devices prior to subsequent MRI imaging. This workflow is often performed by an MRI safety officer, and we feel is critical to ensure that these devices are safely managed. For patients, it's important to recognize that you have devices that require special care around subsequent imaging and subsequent surgery, and that your clinicians may need to think carefully about how your device would best be managed. Now, although details are constantly changing and the manufacturer recommendations also change, part of the goal of this review was to help provide some understanding as to why the current recommendations are made. We think that overall this will improve the safety and the management of these devices for patients in the future. We invite you to read the full details and to find some comprehensive tables in this article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.